All right, we want to thank you for staying with us on TMI Monday Morning Edition. We'll go straight to the second segment on the show. It's World Polio Day, and the theme for this year is Together Let's End Polio. And I have two medical and experts here that will be joining us to look at it together. From my immediate left is Dr. Efemenai Onuwogbeda. He's the Monitoring and Evaluation Officer for the WHO in Edo State. Good morning, Doctor.
Good morning, sir.
And from my extreme left is the consultant in charge of the Benin University Teaching Hospital, Benin City, is in person of Dr. Ehis Bodeno. Good morning and welcome to the show.
Good morning, you're welcome.
All right, let's quickly start with you, Dr. Efemenai. Is Nigeria polio free?
Thank you very much. Yes, as of today, Nigeria is polio free. We got certified polio free as far back as 2020, where we were given that certificate by the global certification body, and then Nigeria was declared polio free. So Nigeria is polio free.
So if you say Nigeria is polio free, we still have issues, religious issues, belief, and all that. Let's come to Dr. Ahis. Could religious belief hamper the eradication of polio in the country?
Yes, of course. If, as he just said, precisely October, that's August 2020, we declared polio free by WHO and UNICEF. And at the point, it was just only 3 countries in the world, and Nigeria was one.
Well, that means we are doing a lot as a country.
Yes. Nigeria was just one. We're the last in Africa to be declared polio free. And the reason behind this was because of religious and cultural issues. Because till today, some persons believe immunization is actually a Western way of trying to suppress yes, based on religious view or cultural view. At the point I could remember in this country where some persons were saying that immunization is to reduce fertility, especially in the northern part of the country. Yes, obviously you can also see, especially when you are taking a walk around the metropolitan, you see a lot of cripples. It was as a result of measles. But we must give kudos to Nigeria. From 1988 to date, we are able to eradicate polio. And the last case we saw in Nigeria was 2016, precisely in Borno State. And that could be as a result of the insurgency that was taking place there. After 3 years of not having the white polio, Nigeria was declared polio free. We are talking about the white polio virus.
The white, so we have 2 variants now.
Yeah.
So educate us.
On the variant of the polio.
Generally, we have 2 major groups of polio virus. We have the wild polio virus, and we have the circulating vaccine-derived polio virus. The wild polio virus is the one that we have been certified polio free, is the basis for certification. So once you don't find wild polio virus in that country for at least 3 years, you certify that country as being polio free. But then you now put all surveillance mechanisms and continue other things like routine immunization, supplementary immunization activities to maintain the herd immunity of the children in that community so that they do not develop circulating vaccine-derived polio virus. This is usually caused by where you have areas where there are poor vaccination, where you have poor coverage of polio vaccines. You also have all these religious and cultural issues that have been mentioned affecting the uptake of polio vaccines. So as a result of that, that's low immunity. Sometimes the vaccines now mutates and then you can now have it actually causing polio. The last case that was seen in Edo State was last year, September. Yes, we had a case of circulating vaccine-derived polio, and that was what led to about several rounds of immunization. I think from that we had a round in October, November, February, April, May. So we had that supplementary immunization activity because of that one case, just to build up the immunity of the people, because one case can spread around the whole state. But I can tell you that from that time till date, we've not had any of such case again because of the
How sure are
activity.
you with your analysis?
Yes, because routinely we have what we call, there's an indicator we use to monitor it. We used to actually, we have what we call the non-polio AFP rate. And that means that anybody that is seen that any child that presents with paralysis, any child below 15 years old that presents with any form of paralysis, we rapidly investigate that child, collects 2 samples, and send to the lab. Then,
So who pays for?
it's free of charge.
Okay.
It's free of charge.
Okay.
We collect 2 samples, we send to the lab, and then the test is done and checked for polio. So we are picking up flaccid cases, that's the paralysis cases. But when we test the stool, we don't see the polio virus. And so we have
And the person is certified.
so we have that activity is ongoing in Edo State and has been ongoing in Edo State, conducted by WHO in partnership with the Edo State government and the DSN, or the Disease and Surveillance Notification Officers, across the 18 local governments in Edo State. And so from all the samples collected so far, none of them has presented with polio virus. We also have the environmental surveillance, where routinely there are 3 hotspots in Benin City where samples are taken, because people, we still have open defecation in Nigeria and even in Edo State. So people go stool in water. So we have points where we collect, send it to the lab, and then they also check for it, and we have not found polio virus in any of those samples collected.
Okay, I know Favor have a
Doctor,
question.
against this year's team, Together Let's End Polio, how much awareness do you think the people have about polio?
Oh, well, as you just said, as the theme of this year goes on, this is not the first time we're having team. Every year since 1980s, we have been having teams. And the essence of that is to actually sensitize people. Even this year, the Rotary, including collaboration with WHO, UNICEF, and some NGOs, including my hospital, Igbenedion University Teaching Hospital, we have actually keyed into the World Health, that's the World Polio Day, beyond and beyond, a healthy future mothers and children. It's not just the name. The activities are actually planned since 1988 to date, especially this year, is that there's going to be mass mobilization and sensitization, just like the program we are doing today. People also in the field, including the Nigerian Medical Association, where they enlighten people, they pay advocacy. Not only that, there is active surveillance, as you just said, whereby people go to the fields, people who are having paralysis or illnesses that we think they are, because apart from paralysis, there are other presentations of polio.
Absolutely.
Absolutely. So therefore, samples are taken, and by doing that, you meet the people in the field one-on-one. Like this year, from 25th of this month, the Rotary in particular in the Edo State, with collaboration of WHO and some NGOs, has actually kick-started exactly what I just said by doing this sensitization and mobilization. They also went to the field and mobilized and immunized our children. And they actually kick-started in Use, here in Edo State. And I think year by year, as we continue to do this sensitization, and we're organizing such programs we're having today, people are being aware. And in teaching hospitals where people come to immunize, even in PECs, mothers are being educated. That's why the WHO and Rotary actually directed this year to healthy future mothers and children. And you know the relationship between mother and a child, the emotional attachment. When the child is sick, the mother is also mentally sick.
Okay, earlier you talked about the religious issues hampering 1 or 2 of your activities. What has been the response of these mothers? Because when you talk about immunization, the people that are going to be custodians of these children while you are immunizing them are definitely going to be the mothers. So what has been the response of mothers considering education and religion of these mothers?
Yeah, well, I would say in the urban areas like the Benin City, the awareness is very high.
What about the rural areas?
The rural areas, I would say, especially in the northern part of the country, is very poor. But however, it is the work of the health personnel to actually spread the news.
Okay.
And obviously, we are trying to do that, and also in the media.
Okay.
Can also help us to do that. But obviously, I have told you that we have actually have a huge success. That is the reason we're able to eradicate this disease.
All right, let's
And
get
we
to
are not going to
Dr.
stop that. We'll continue.
Okay, let's get to Dr. Efe as we begin to round up now. You told us Nigeria is polio free, but have you been getting support? You are of the WHO.
Okay.
So what support have you been getting from them?
Okay, I just want to quickly state that there are 4 strategies towards combating polio. One is active surveillance that I talked about.
Yeah.
2 is routine immunization. And this routine immunization, so far so good. Edo State government in collaboration with the WHO have been very high on that.
Okay.
And as we speak, we have routine immunization intensification going on across all the local governments in Edo State
Okay.
in a bid to increase the immunity levels of our children. Then we also have supplementary immunization activities, and I told you we've already done about 5 in the last 1 year.
So you said.
Then we also have mop-up campaigns where when we identify that there's a problem here in terms of immunization, we're pushing people into the field to go and help us mop up those stuff. So those strategies have been helping us to actually keep Nigeria polio free.
Okay.
However, like I told you, we've been having some pockets of circulating vaccine-derived polio, which is why we still want to encourage our mothers that whenever you see, when you hear the year of campaigns, like polio campaigns and all that, they should open their doors to these healthcare workers to actually administer these vaccines. In the next few weeks, we have a measles campaign coming up where health workers will move from house to house to administer our children measles vaccines. So we're also encouraging mothers to avail themselves of this opportunity and get their children below 5 immunized against measles.
Okay, thank you so much, Dr. Efe. Dr. Hayes, I'm afraid this is where we'll be. During the court, you wanted to say something, but
Yes, I just want to add to what he just said. And our parents has to be very serious,
Okay.
apart from sensitizing people. You see, sending people to the field to immunize is not just all. Accepting them is a different thing entirely.
Okay.
In most communities, both the urban communities, they hardly accept the health personnel coming to their houses to immunize their children.
Okay.
So that should be what we are going to work towards. So that by the time you come, somebody come, especially wearing WHO outfit, coming to introduce in his or her, said that we are coming from WHO or we are coming from Ministry of Health, we are coming to immunize our children. We should accept them.
All right, thank you so much, Dr.
Thank you.
Hayes.
Thank you very
Well,
much.
we will be taking a short pause now. Solomon, I know, is standing by to take us through the breakfast sports segment. Don't go nowhere.